So we're all here today because we recognise the challenge ahead in reducing ICT emissions in line with both broader government and NHS targets, which we've heard from Sonia on that. And we're also here because we recognise the importance of public and private sector collaboration and partnership to delivering this. I think it's particularly key in healthcare, but obviously we can see that across a number of other industries as well. So before we dig into some of the focus areas and practical application points, we just wanted to spend a bit of time outlining the parameters of the challenge. And as Peter says, and as has already been spoken to this morning, the opportunity that we can see and specifically how it relates to healthcare. So we know that ICT emissions are growing at 15% per year globally. We also know that enhanced efficiency won't solve the problem. So it's clear that any impact on greenhouse gas emission reduction is soon swallowed up by increased usage. We also know that cost and carbon cost are not aligned. So currently procurement decisions aren't able to really consider the carbon cost alongside the financial cost. We are seeing some moves towards this in other areas of the NHS, such as medicines procurement. We know that outsourcing to cloud providers can increase emissions, as has already been spoken to this morning. And we know that there's a gap currently between ESG targets and operational decision making. Although we should point out that we can see that gap closing further, the more the NHS goes along the journey, particularly with the delivery and integration of the green plans at ICS level. But there's also an opportunity. So as Peter's spoken to, IT could be the first industry to decarbonise. And secondly, we believe that decarbonising IT can really unlock co-benefits of both enhanced health outcomes and a lower carbon footprint. So we're talking here about digital care pathways, we're talking about care closer to home. So what can digital technology really unlock? And of course, this sits within the wider context of knowing that mitigating the impact of climate change is vital in terms of both system-wide health trends, the impact on the NHS and individual health events. And finally, we think there's an opportunity in terms of decarbonising IT to really equip the workforce with skills to support the NHS transition. Peter.
It's very important to really understand what we call the carbon law, which is this reduction curve. It's really to understand that every year counts and that 2022 needs to see an 8.65% reduction in CO2. So that's the first thing, is being understand when we talk around being aligned to a trajectory on net zero, that we put this into figures. And we've worked with a number of clients, both in the public sector and in financial services. We're seeing great interest from the private sector as well. But the sort of initial findings from those original projects are that you don't need to think about 1,000 things to do. There are some real key, we've said the 3 key steps really to do things now and focus on now is around decarbonising the hardware embodied emissions. So this is really the scope 3 supply chain emissions. So every time you buy a piece of hardware, you are taking the responsibility of those scope 3 emissions. The most environmentally friendly hardware is the ones you already have. So if we can extend the life of those, if we can look at remanufacturing, if we can look at different business models around providing hardware as a service, all of those things can count in reducing the need for new hardware. There's some really interesting things that we haven't validated this, but there are some worrying data around cloud providers, for instance, maybe refreshing their hardware every 9 months. So, that's something we have to get ahead of. The second one, I think, is around data centers. So this, although hardware may be the highest proportion of your footprint, it's the getting ahead of data centers and how they operate and how much green electricity they actually consume today is really important, because they are the biggest growth area that Mary was talking around. We're typically seeing a sort of anywhere between an 8 to 15% increase in data center usage, which is going directly into CO2 emissions because as you know, the UK grid isn't 100% sustainable electricity at the moment. And the third piece of advice we would give to any client is really data gaps, you don't have to have perfect data here. You have, the important thing is to get the data together, the right level of detail, and improve it as you use it. So you don't have to wait for perfect. You do have to be quite rigorous about the methods that you're using and how the calculations are performed. And we've helped sort of standardize that. But the really important thing is to start to get that first baseline in place as complete as possible. And also, Mary talked around starting to think around the cost of carbon and how do you get carbon into cost into your normal decision making. So every time you make a procurement or a new project, make sure that you're starting to think around the extra cost of carbon so that you can compare on a level playing field between alternatives you'll be looking at. And next slide, and over to Mary, please.
Yeah, absolutely. Thank you. So there are three points here in terms of really how to integrate some of those principles and priorities that Peter outlined. And the first one is really integrating net zero within an IT strategy. And I think this is something that Sonia has actually already spoken to in terms of her introduction. I think one important starting point is really considering the tech intensity and demand, the uses of diagnostic electronic equipment and devices, and just really having a key idea there, particularly of medical devices in terms of the emissions and the usage, the difference between perhaps corporate and clinical technologies. Secondly, I think it involves developing digital care pathways that support the net zero ambition. And really ensuring that every digital service is designed in terms of carbon resilience and mitigation. And then finally, identifying and prioritizing some of those co-benefits of enhanced patient outcomes and decarbonisation. Secondly, so scaling up and collaborating for impact. So the role here, obviously, of the CIO is crucial in terms of developing solutions both at enterprise, supply chain and industry level. We think there's a huge amount of work that could be done within procurement specifically, considering the carbon impact. We know that the NHS is already looking at that in other areas. And thirdly, how we can consider net zero within an innovation portfolio and within funding more broadly. And finally, embedding green skills and decision making. So this really looks at how considering how green investment and decision making will be integrated at leadership level, but also right through the organization. And we think there's an opportunity to really build a green workforce. That could also include like realigning incentives and ways of working to support the ambition. That's something we've seen in the private sector. And I think the final thing to add on this is we actually have a report that we've just produced with IEMA on green skills, which I believe is published this week. So that speaks a lot to the importance of really embedding these green skills within the organisation.
Okay, and just to finish off, I wanted to give you a bit of a sneak preview of some of the data that we're working across these projects with clients. So the two graphics here really talk around, we felt it was very important to start to look ahead to what 2030 looks like, which is the first sort of waypoint of halving your emissions. So we turn clients' IT strategy into what does that look like from emissions point of view. And here you'll see the big blue area is really what we talked around before about the embodied emissions within devices. And there will be, most of our clients are looking at moving from on-premise to cloud. That is reducing the total figure of emissions, but we're then seeing the increase in demand that they're having to do. And the NHS is working extremely hard in many different areas, and demand for IT is increasing. So by seeing that, and actually because there's no real sort of black on the first slide, there isn't really any headroom in massive reductions in CO2 based on current strategy. So that's why I say there's a real need for shifting, and that's where we're starting to help clients understand what a plan for net zero would look like, and embed that within the IT strategy. So the blue line now, the curve on the right hand side is the black is all the CO2 emissions that they do today. and the coloured lines are cutting into that over the next few years. If we cut into that by looking at hardware, extending the life of hardware, the very thin yellow line, if you can see that, is actually the efficiency gain of moving to cloud. So by actually quantifying that and seeing that, yes, it does contribute, but it may not be the biggest thing. The big green line there is really the switch to green electricity supply, making other significant. So there are other things you can do in the short term around workload optimization, design for sustainability, and there is also a need for innovation. But just we've taken the numbers off these to protect the innocent, but essentially this is the kind of information we can help a client understand: is what is their current trajectory look like, and what would they need to innovate and change practices with. So thank you very much. I think that sort of concludes the sort of overview of some of the challenges and opportunities, if you like, in the sector.